Dr. Arjun Majan here today with you from Deuk Spine Institute on our YouTube channel with Spine Scams Exposed. And we're going to talk in this segment about artificial discs. All the hype, all the buzz, are they really that great? Are they the answer to all the problems that people are having with pain in their neck or back? What are the advantages, pros, of having an artificial disc, and what are the cons? Is the artificial disc really the best treatment for you? These are all important questions that people ask, and we're going to have some answers for you today. So first of all, what's the purpose of doing an artificial disc surgery? Well, it turns out that in some people, they develop a damage to the joint called the disc in their spine. And we have discs in our neck, we have discs in our lower back. The discs are the big joints that allow movement between the bones. Fact is, discs do get injured and they do cause pain. So you can actually go in there and remove a disc, and instead of fusing the two bones together that are on the top and bottom of the disc, you can put a metal disc in there that moves around. So metal discs have sort of taken the place of fusion in many places. Is that really the best option? In my experience, no. I've looked at the data from all the studies that have been done on artificial discs, and I believe that the fusion data is actually better than artificial disc data. The complication rate with artificial disc surgery is said to be the same as fusion. It's around 5% to 10%, depending on the study you look at. So let's just take a look at one of these patients who had artificial discs put in their neck. And remember, artificial discs were first approved to do one disc, and then they expanded to 2, and now 3, and there's really no limit now. Artificial discs are put into multiple disc herniations and disc injuries, and people are getting them put in all over the world. So are there any issues with these artificial discs? The answer is yes. Let's take a look at this MRI right here. This is a cervical spine MRI, someone's neck, and if you look at my arrow and follow it down, you can actually see that this person had 2 artificial discs put in through the front. They had them put in at, if we count 2, 3, 4, C5, C6, and C6-7. And you can already see the artificial discs are getting pushed out of the disc space. They're actually popping out of where they were put during surgery. Okay. Here's an example of those discs, and you can see they've migrated. We call it migration, where the disc has actually moved out of where the surgeon put it. You can see the one at the bottom has moved off to the side, and the one above it seems to have popped out in the middle. Okay, that's a spine x-ray. If we look at the side view, you can see it better. You can actually see that there's 2 disc herniations, 2 discs that were herniated and repaired with these cages and artificial discs. All right, so these things can pop out, and they can cause lots of problems for people, and you need to be aware of it because they're not a perfect solution. There's still a piece of metal that's being put in your spine, and there are forces on the spine that occur when you flex and extend, when you laterally bend, and when you rotate. And when you start to move your head in multiple directions at the same time, you're putting a lot of different forces on that artificial disc, and it can literally just pop out of place. So migration of artificial discs is one of the biggest problems. It happens, and when it happens, it's bad. The surgeon has to go in there emergency surgery and get through all that scar tissue from the last surgery. It's very dangerous. You could have blood vessels stuck together and stuck to your esophagus or trachea, and they have to rip those open and cause horrible complications like strokes and paralysis. You want to avoid it. Far better than an artificial disc, I recommend you take a look at the Deuk laser disc repair. With the Deuk laser disc repair, there is no artificial disc, there's no fusion. We don't put any metal into your spine. It's literally endoscopic repairing the back of your disc where the problem is. We leave your natural disc. So there is no total disc replacement, there's total disc leaving. And basically you get to keep your disc that you had, that you were born with, that's still working fine. It's just the part in the back that needs to be repaired, and that's what we do with the Deuk laser disc repair. All of this is done with a very precise medical grade laser called a Holmium YAG laser, and the procedure is done outpatient. It's not even done in the hospital. You do it in a safe clinic at Deuk Spine Institute. Hope you enjoyed this segment and learned a little bit. I'm Dr. Deuk Majan with Spine Scams Exposed.